A central line is a tube that goes into a vein in the chest and ends at the heart. It can carry nutrients or medicine into the patient's body. It can also be used to take blood when needed. Therefore, it is crucial that you maintain a good sterile technique to prevent the introduction of any microorganisms into the bloodstream. With that being said, it is important that we are not breathing directly on the area to add any more microorganisms to the site. So it's important to have a mask of your own and also a mask for your patient. Once you place the mask on your patient, make sure their head is turned away as well. Now let's get started. As you can see, I am using regular clean gloves to pull up the old dressing. This part is not sterile. As you pull up the old dressing, this is a good time to start assessing your insertion site. Look for any redness, swelling, or drainage at the site, and make sure that you document that and let your physician know. Once you've discarded your old dressing, now we remove our clean gloves. It's now time to set up our sterile field. Make sure that the table is at a waist level, and we're going to open our package while placing the inner package with the drape on a clean, dry area. I also made sure that where I'm going to be setting up my sterile field is right here in front of me. That way there's no risk of turning my back when I'm facing my patient. So if you need to, you could move the table closest to the insertion site. You're going to open your drape away, then follow the prompts of the drapes, side to side. And lastly, you will pull the last flap down and turn it to make it into a square. Once I've created my sterile field, then I apply my sterile gloves. I left enough space on the dry area of the table to make sure that I can open my sterile gloves without it interfering with my other sterile field. Once I have my gloves on, now I can touch everything within my first sterile field. What's included in your kit is a mask, which you've already used. You also have another set of sterile gloves to keep beside you in case you contaminate the current ones. And now we have our cleaning supplies. We have the ChloraPrep and the alcohol swab. We have multiple uses of gauze and tape in case we needed to put down our Tegaderm. We have more gauze, an extra label. This is representing a biopatch. The biopatch is like a chlorhexidine impregnated sponge that's placed at the insertion site, and it provides continual antisepsis over the next 7 days, preventing any skin organisms from entering at the insertion site. The first cleaning supply that we're going to use is our alcohol swab. So as we open up the package, I placed it over on the side where my second sterile field was created to use as like a small trash. When you open up your alcohol swab, make sure you grab a gauze because we have to lift the catheter. And if you touch the catheter, which is now unclean, that could contaminate your sterile gloves. So you start at the insertion site and you clean in a zigzag motion outwards. My next cleaning supply that I'm going to use is my chlorhexidine sponge. It makes this click sound when activated, and you start at the insertion site and clean in a circular motion outwards. Make sure you are also cleaning up your line because that part of the catheter will be under the new clean dressing. Once you finish cleaning, you can let go of the catheter. Then you will grab your biopatch and place that at the insertion site. The last step is to place your new Tegaderm dressing. You'll pull apart the paper from the sticker. You'll place the sticky side down and then make sure that it's centered, that your insertion site is centered at the tape, and press in the middle, then work your way outward. That avoids any bubbles being collected under the dressing. Once you push down your tape, it is now time to remove the paper border around the Tegaderm. There's a slit at the top where you can pull the paper. Start there, and then as you pull the paper up, push down on the tape on the borders to make sure that it is occlusive, meaning that the tape is secured to the patient's skin. You are now left with a nice clean dressing that is occlusive on all edges. Now it's time to label. You'd write down here with your date, time, and initial, and you pull that label off of the paper and stick it onto your patient. That lets other nurses know that it was changed at this date, and in the next 7 days, it needs to be changed again. Now you can remove your mask from the patient, clean up your area, remove your sterile gloves before you have to remove your mask. And then once you remove your mask, perform hand hygiene.